Welcome to the Frozen Shoulder series. Today is part 4, and we're going to talk about the causes of frozen shoulder, risk factors, and theories. So these are some of the risk factors for developing a frozen shoulder. Repetitive motions, where you do the same thing over and over again. Sports injuries, where you're using your arm quite a bit, as in pitching. Fractures of the collarbone or the upper arm can bring on a frozen shoulder. Immobility. And for those people who think that for a frozen shoulder they should have it in a sling or not use it very much, actually we encourage just the opposite. We want you to move it as much as possible, just short of that zinging kind of deep penetrating pain that may develop. Just avoid that kind of motion, but use your arm as best you can in all other motions. Surgery, especially after shoulder surgery, and mastectomy with breast reconstruction, and diabetics, they're about 5 to 10 times more likely to develop a frozen shoulder. There are several theories as to why a frozen shoulder may develop. Some people feel it's hormonal, does affect females about the time of menopause, but men develop frozen shoulder as well about 40% of the time. There have been several studies to indicate it's a genetic component. There have been several cases where identical twins have developed a frozen shoulder at the exact same time, and the condition can run in families. There may also be an autoimmune component to this as well, and that may explain why it doesn't return to the same side, or very, very rarely. And for others, it can appear for no apparent reason. Frozen shoulder syndrome was first noted back in the late 1800s, and one of the most convincing studies so far has indicated that poor posture may have a huge relationship to the onset of a frozen shoulder. And that's one of the reasons why posture correction is an integral part of our correction of the frozen shoulder when patients come to see us. Dr. Stetson is an MD. He's an orthopedic surgeon. And he says that 50% of patients go on to surgery if they're only treated with physical therapy. Well, we use physical therapy on our patients, but we also use a number of other techniques as well. And there's a reason why our results are so good. 90% experience very good to excellent results, and we're very proud of that. There is a better way, and we're going to tell you a great deal more about that in the next few parts.